So the abstract that I'm presenting is Poziotinib for patients with HER2 exon 20 mutant non-small cell lung cancer. This is a phase 2 trial. So HER2, ERBB2 mutations occur in 3% of lung cancer patients. And if you look at 48% of HER2 mutations, including variants of unknown significance, are exon 20 mutations. The current standard of care for these patients remains cytotoxic chemotherapy with or without PD-L1 inhibitors, which have limited activity for these patients. So this is a single-arm phase 2 study with Poziotinib, which is an orally available irreversible covalent TKI. It shares actually its quinazoline backbone with afatinib and dacomitinib, and because of its smaller size and increased halogenation, the molecule is very flexible and it can circumvent the steric hindrance that happens to the drug binding pocket in the HER2 EGFR20 insertion mutation patients. So the objective was to determine the anti-tumor activity of Poziotinib, which is an irreversible covalent TKI in these patients with HER2 exon 20 mutant NSCLC. So single arm, single study, phase 2, open label, multi-cohort study, which included all adult patients with stage 4 or recurrent HER2 exon 20 mutant lung cancer. The exon 20 HER2 mutation was documented either by Oncomine comprehensive assay or Garden 360 on plasma, or a Foundation 1 assay. ECOG-PS had to be 0 or 1 with adequate organ function and measurable disease. So this was a 30 patient data. 35 patients were screened, 30 were included. Median age was 60. Majority of the patients were never smokers, all of them adenocarcinoma. And if you see, 90% of patients had received prior platinum. So the exon 20 HER2 mutations, again, they described as most common one was the YVMA type, which was 77%. So they did not include the entire 20 insertion panel. This is only the HER2 mutant patients. So, these are the RECIST 1.1 criteria response rates for the patients. Confirmed PR happened in 27% of patients. Stable disease in 46%, so overall response rate was 27%. Response rate at 8 weeks was 43%, and disease control rate came out to be 73%. So median duration of response was 5 months, median PFS was 5.5 months, and the PFS rate at 6 months and 12 months was 30% and 10% respectively. So a badly doing cohort of patients we know. So this is the waterfall plot of the best response. And these are the curves for the duration of response and the PFS. Median duration of response was 5 months and median PFS was 5.5 months. So responses were seen across all HER2 exon 20 insertion types. DCR was 73%, median overall survival was 15 months. So overall, if we see, the side effect profile was like any other TKI. Some similarities with afatinib and dacomitinib because of its structural similarity. So more than 80% of patients did have all-grade skin rash, 80% had diarrhea, 70% had paronychia, and more than 60% had skin-related problems, dry skin, oral mucositis. So if we see the Zenith trial, which was done after the starting of this trial, but the results came out before, and this was a comparative arm study where they compared the 6 mg per BD and 8 mg BD dosing. A partial response of 28% was obtained with a DOR of 5.1 months. But they included all types of 20 insertion mutations. Destiny Lung 01 enrolled again patients with any HER2 mutation, and there are some obvious advantages of using an oral TKI vis-a-vis an IV drug, and we all know that There could be serious side effects with deruxtecan. Discontinuation rates are also quite high. Interstitial lung disease at the presentation makes the patient ineligible for that drug. So there are some marked differences between these two drugs. Again, the study with TDM1 was not very exclusive for this kind of a mutation, and ultimately the response rate was 44%. So to conclude, Poziotinib as a single agent, it did show promising anti-tumor activity in this group of patients who had previously received platinum chemotherapy. Currently, the therapeutic outcomes are quite limited, and with heavily pretreated disease, there is no defined standard of care treatment. So this study also used 16 mg per day of dosing, and this was quite effective with significant but manageable toxicity and frequently required dose reduction. Thank you.